Biomedical therapies treat psychological disorders by intervening directly in the brain's biology through drug medications, electrical or magnetic stimulation, or in rare cases, surgical procedures. They stand in contrast to psychotherapies, which work through learning, insight, and behavior change. Psychopharmacology is the field that studies how drugs affect the mind and behavior. Since the 1950s, the development of psychiatric medications has transformed mental health treatment, moving many patients from long-term hospitalization to functional community living. The discovery of the first antipsychotic drugs in the 1950s helped drive deinstitutionalization, the large-scale release of patients from psychiatric hospitals. Medications allowed many people with severe disorders to live outside institutions for the first time, fundamentally reshaping mental health care. All psychiatric medications ultimately work by altering the activity of neurotransmitters at synapses, increasing or decreasing the availability of particular chemical messengers. Understanding this mechanism is essential to understanding both their therapeutic effects and their side effects. Antipsychotic drugs treat schizophrenia and other psychotic conditions primarily by blocking dopamine receptors, reducing excess dopamine activity. They are most effective against positive symptoms, hallucinations, delusions, and disorganized thinking, and less effective against negative symptoms like flat affect. A serious side effect of long-term first-generation antipsychotic use is tardive dyskinesia, involuntary, repetitive movements of the face and limbs. Newer atypical antipsychotics carry lower risk, but introduce metabolic side effects including weight gain and increased diabetes risk. Anti-anxiety drugs, primarily benzodiazepines like Xanax and Valium, enhance the activity of GABA, the brain's main inhibitory neurotransmitter. They are fast-acting and effective for acute anxiety, but carry significant risk of tolerance, dependence, and withdrawal complications. Antidepressants are first-line treatments for both depression and most anxiety disorders. Selective serotonin reuptake inhibitors, SSRIs like Prozac and Zoloft, work by blocking serotonin reuptake, increasing the neurotransmitter's availability in the synapse. They typically take 2 to 4 weeks to take full effect. Mood stabilizers are used primarily for bipolar disorder. Lithium, discovered to treat mania in the 1940s, remains a first-line treatment for preventing both manic and depressive episodes. Its mechanism is not fully understood, but it effectively flattens the extreme mood oscillations of bipolar disorder. Electroconvulsive therapy applies a brief electrical current to the brain, inducing a controlled seizure under general anesthesia. Despite its alarming reputation from mid-century practice, modern ECT is safe and remains the most effective treatment available for severe, medication-resistant depression. Modern ECT uses brief pulse electrical stimulation rather than the prolonged shocks of earlier decades. Side effects, particularly temporary memory disruption around the treatment period, are generally mild and reversible. For patients who have failed multiple medications, ECT can be life-saving. Transcranial magnetic stimulation uses powerful magnetic pulses delivered through a coil held against the skull to stimulate specific brain regions, particularly the prefrontal cortex. It is FDA-approved for treatment-resistant depression and requires no anesthesia or seizure induction. Deep brain stimulation involves implanting electrodes in specific brain circuits and connecting them to a programmable pacemaker-like device. Originally developed for Parkinson's disease, it is being investigated as a treatment for severe OCD and treatment-resistant depression when nothing else works. For most disorders, combining medication with psychotherapy produces better outcomes than either treatment alone. Medication can reduce symptoms quickly enough to make psychotherapy possible, while therapy builds the skills and insight needed to maintain gains after medication is discontinued. Drug trials must control for the placebo effect, genuine symptom improvement that results simply from believing one is receiving treatment. In antidepressant trials, placebo response rates can be remarkably high, which is why double-blind designs comparing drug to inert pill are essential for evaluating efficacy. Psychosurgery, surgical alteration of brain tissue to treat mental illness, is now extremely rare, reserved only for severe, intractable cases when all other treatments have failed. The history of lobotomy, stands as a cautionary tale about what happens when untested procedures are widely adopted without rigorous evaluation.